I'm Kenneth, and today I'm going to talk to you about asthma and its treatment. So, what is asthma? In a normal bronchial, we're going to have a space for the air to flow so the person can breathe. However, during an asthma attack or an asthmatic patient, this airway is going to be obstructed. How? The smooth muscle in the airway is going to be contracted, and also there's going to be hyperproduction of mucus. So these two factors are going to reduce the space for the air to flow. Then the individual is going to get coughing, wheezing sounds while breathing, or shorted breath. So how can we treat this? We can have two approaches. The first approach is going to relax the smooth muscle so we can have more space for the air to flow. How can we do this? We can do this with beta-2 adrenergic agonists. This type of drugs are going to activate the adenylyl cyclase that is going to produce cyclic AMP. And the cyclic AMP is the one that is going to relax the smooth muscle. There's two types of beta-2 adrenergic agonist. The first one is the short-term action, like albuterol. Like albuterol, they're going to be given as maintenance drugs or rescue drugs. This is important because since they act short-term, they can be used in asthma attacks, acute asthma attacks. The second type, the long-term acting, cannot be given as rescue medicines because their mechanism of action is long-term. Examples of this, salbutamol or formoterol. And the long-term beta-2 adrenergic agonists are usually given in combination with corticosteroids like Flovent. This corticosteroid is going to be in charge of reducing the production of mucus. Hence, now we have also more space for the air to flow. So they're given in combination so we can solve for both of the problems during asthma. They can be administered inhalated or oral form. In the inhalated form, we're going to have the advantage that is going to be delivered straight into the place that we want to act, the airway. So this is going to reduce the toxicities because we're just administering the medication into the airway. Orally, we're going to have a systemic delivery, so it's going to have more toxicities. It's also important to say that inhalated forms can be used as maintenance and as rescue medicines. Orally, since it's a long-term acting, we can only use it for maintenance doses. I hope that this explanation can clarify and explain the asthma treatment.